Hi everybody, I'm Amy from Body Fit by Amy, and today I am talking to Dr. Marcy Crouch. She is a pelvic floor physical therapist, board certified in women's health, and we are both busy moms of two. And I just wanted to talk to her about some common pelvic floor issues, some things I talk about a lot, and give you all a little bit more information from her standpoint. So let's talk about how do you know if you have a diastasis recti?
Well, come see a pelvic floor PT.
Yes.
So I think during pregnancy, the goal kind of is to just manage it as much as we can, right?
Yeah.
So
you can't fix it during pregnancy.
Yeah, right. Like treatment really should happen like postpartum. But we want to try to reduce the risk as much as possible. So postpartum, like around the 68-week mark, I think you have some videos on this.
Yes.
You can check yourself just feeling with your fingers, like when you come up into a simple curl, to see if you feel a separation in between the two walls of the muscle. And you can do that at any point down the linea alba. If you notice tenting when you're coming up after baby, a lot of women will come to me maybe 4 or 5 months postpartum and say like, oh, I still feel like I look pregnant. I have this like lower kind of bulge here. That's sometimes an indication that there's a diastasis present. Feeling just disconnected and weak in your abdomen, like I can't quite figure out how to like engage it the right way. Like how do I do that? That's another indication too. And then when you come to therapy, we have kind of a systematic way to measure with a tape measure to kind of see like what your baseline is and where the separation is throughout the linea alba.
Yeah, and it's also important to note that you might recognize it during pregnancy. You can't fix it. The goal is just to maintain and be strengthening that deep core, protect it. And that in the postpartum period, we also want to avoid those things. If you think or know that you have it, especially in the early days, we want to, once you're cleared for exercise and activity, we want to avoid the same things that we avoid in pregnancy. Yeah. So as you're healing and, restoring all of your pelvic floor and your deep core, trying to avoid planks, push-ups, things like that. That's a question I get a lot because people are anxious to get back to what they're doing. Sure. But I would say for everybody postpartum, whether you have a diastasis or not, it's good to work on healing the deep core and the pelvic floor first. Yeah. But especially if you have the separation and you know that you have it or you think that you have it, to see a pelvic floor physical therapist. And then I do have tons of videos, but I didn't just do that. I also saw a pelvic floor physical therapist myself, who was a former teacher of yours, which was great. Yeah, sure. And it was so helpful, even though I know the muscles and I have, researched this and studied this and worked with a lot of women. It was very important to have somebody else helping you through it.
Yeah. And I would say during pregnancy, if you do notice it, you're appropriate anyways for an evaluation and kind of like training as far as like proper movement and open mouth pushing when it's time to deliver and decreasing Valsalva and how to like poop the right way so you're not, pushing out your abdomen. I have a lot on pooping. Yeah. And also like what to do immediately postpartum. Right. Like I teach a lot of women, like at the hospital, like let's get your compression on, how to move out of the bed, how to like, wear those mesh panties with like, how to do that the right way until it's time to come to therapy at the 6 to 8 or 12 week mark or whatever the case may be. And a lot of times, that doesn't happen. Like we don't know how to move or engage our abdomen, 6 hours after the baby is born. Yes. But that's definitely something that we can teach in therapy and make sure you're in the right type of compression garment and, kind of all that stuff.
And also if you, another thing is C-section. It's another way that, you have a big incision across your abdominals. Yeah. So just knowing how to move, how to get to the baby, how to, it's hard to do when you have a newborn, but important to do, at least to be thinking about it as much as you can and incorporating the things that you can show people and I can show people.